It's important to recognize right up front that we're not treating autism per se. We're treating comorbid anxiety and mood problems in the context of autism. So we're trying to treat the secondary conditions, social and communication deficits. That's our secondary target. The third focus is going to be on activities of daily living. A lot of families come into the programming having very little information about how to manage their kids' behavior. And so we're typically taking people who are higher functioning, typically taking people who have the verbal skills that are going to be necessary to do exposure-based work or behavioral activation. So we're trying to help people with the comorbidities. Because the reality is, something we've studied at Penn and studied at Drexel, a number of other places have done it as well, is that the majority of patients with autism have a comorbid disorder of either an anxiety or depression or something like that that's above and beyond, separate from their autism. So we're trying to treat the secondary conditions with our knowledge of autism, our knowledge of exposure and behavioral activation, putting all that together so we can help these people to more slowly confront the situations that provoke their discomfort and more effectively tolerate that discomfort. But because we recognize we have folks in the program who have autism, we also spend some time on social and communication deficits. That's our secondary target. Because we recognize, by definition, these folks are going to have difficulty with communication, difficulty with social communication, reading cues, understanding the context in which they find themselves, especially when they find themselves when they're upset. So doing skill-based stuff, doing practice on how to ask somebody to not do something that you don't like, things like that. We'll do a lot of role-playing, a lot of practice to try to help them manage the co-occurring condition, but also manage their own behavior in social contexts. The third focus is going to be on activities of daily living. Because we know, again, with the autism population, that there are going to be some issues there. So making sure that they're brushing their teeth, making sure their hygiene's good, making sure they're eating properly, making sure they're not eating too fast. If we can help them with those things, it may actually help them kind of have less negative experiences in the social milieu, which might, and my concept here is that the lowering tide will lower all boats. So if they're feeling better and functioning better and getting more reinforcement in their social worlds and in their families, that may help to keep some of the discomfort from the co-occurring condition at bay. And there's another piece to this, which is a lot of families come into the programming having very little knowledge or very little information about how to manage their kids' behavior. And also sometimes people come in and they don't really know what services are available. So that's another thing that we can help families with. If they're not well plugged into autism services, we can help them understand what's available in their local community. And we're educating them. They come to Parent University. These secondary co-occurring conditions can be so anxiety-provoking and so disruptive and so demoralizing for the kid and the family that if we can help you learn how to manage that and teach them how to manage that, their lives will be better. They'll feel better, they'll function better, and it'll be easier for everybody to drop the stress level, because it is incredibly stressful to have a kid on the autism spectrum. Just day to day is harder than it is for most people. And we want to try to help alleviate that, and maybe more importantly, teach skills that can then be generalized beyond being on a program. And you can use those skills whenever and wherever the content shifts next.